Well, hello, and good morning. This is Dr. Yonnette with another episode of Baby Talk. I am in a different setting today, so bear with me if I am interrupted while I'm presenting and we are discussing this morning. I totally missed our read time with baby. But like I said, I'm in a different setting. It's hard for me to have my materials and to be able to have the privacy to do our podcast. But I'm coming to you today. And I want us to continue with the sensory strategies we were talking about. There are so many ways in which your child may demonstrate certain behaviors. And I want you to listen out and cue into the behaviors that your child is demonstrating, and then use the strategies that are appropriate to help him or her. You know, even if your child is at school, speak with your child's teacher, share some of these strategies. And if it's a little too much for you, connect with an occupational therapist so he or she can help you through the process. Okay, so let's look at the child who is having difficulties with routines and academics. Okay, routines and academics are difficult for your child. The child is lacking adequate skills. The child is not understanding expectations and rules. The child is he's fearful of being teased, of being left out, of being misunderstood. And those are the internal issues that a child is dealing with. Now, when we look at the external, what are some of the things outside of the child that are impacting the child's behavior? And these may include change in the physical environment. If there's a change in the physical environment, if there's a change in the child's routine, and if the child is having to wait too long, you may see that the child end up having certain difficulties. So let's continue with some of the environmental confusion that the child may end up having. In a crowd, the child may become confused when the child is having excess auditory clutter. The child is having some difficulties there. The child may have what we call organizational concerns, like the desk is a mess, the backpack and the homework, everything is in disarray. And then the child's sensory responses and modulation may be impacted, and so that the child is having difficulties with academics, with play, and during like PE or group time. So, as usual, you want to ask your child, why is this? You want to ask yourself, why is this behavior happening? Why is my child having a messy desk? Why is my child constantly losing his or her homework and he's not able to cope well with the academic demands? So here are some of the solutions that I want you to put in place to help your child through this process. Give the child, or give the entire class for the teacher. The teacher should give the entire class an organizational review, so that maybe even you as the parent can give your child an organization review, so that the child knows exactly what he or she can do to keep himself organized. You want, in the morning, you want to take the time to walk the child through the process of getting his or her things together in a backpack, of how to hand in his homework, of how to, just organize the desk. And then as the child gets the sequence, gets the organizational process, then you pull back in assisting that child. So I'd recommend for about a week or so, you work with your child every morning to get your child organized. And then you pull back as the child learns the process. Have a peer buddy, Sometimes children respond better when they are working with their peers. So find a friend that your child may have in his or her classroom, and then when he or she goes to school, pair them up so that the child is able to keep up with that organization piece, hand in the homework, do whatever he or she needs to do within the context of the environment. And you want to consider using an accordion file folder rather than a 3-ring binder. Sometimes when our children have the 3-ring binder and there's so much stuff in there for them to go through, it becomes very confusing for a child who's having sensory issues. So you want to use that accordion folder and just, color code it out. So all the math work will go in the green section, the reading goes in the red section. So he or she knows exactly where to put everything, organization, how to organize everything, so that he is able to retrieve it when needed. You also want to consider having the teacher or whoever is working with the child conference with you. It might be the daycare where your child is. It might be your teacher in the elementary school, or whatever grade your child is in. Have a meeting with the teacher so that he or she understands where your child is, and they are providing the strategies that your child may need to succeed. All right, let's do one more issue in terms of routine and academics. So in terms of behavior, you're noticing that your child is inattentive and off task or not following directions in and outside of class, at home, at church, wherever the child is. He or she is not following directions. And you want to ask yourself, why is this occurring? Yes, our number one question every time we have a situation is to ask, why is this occurring? And so the answers that you may get in return is that there is too much verbal information coming to the child. You're talking too much, in other words. Decrease the amount of verbal information that you're sharing. The child may have difficulties in terminating and transitioning from one activity to another. So again, help that child through the process. Cue the child in so he or she knows that we are going to transition in 2 minutes, in 3 minutes. Even use a visual. You may want to put up a timer so the child sees when the time is ticking down. And then the child may be having auditory and visual distractions that are keeping him or her from really working with whatever task is presented. So look at that. And then the daydreaming or the shutting down that the child is demonstrating might be due to sensory overload or to fatigue. So what are some of the solutions for this section in terms of the routine and academic issues? I want you to focus in on visual support. Provide visual supports for the child so that the child is able to read, and you're not just giving the child all the information through the auditory system. You want to give the child hand fidgets to keep him alert, oral strategies, water sucking through a straw. You want to provide a seating for your child that is close to you, so you can cue the child back to what should be done and away from a distraction. You want to alert the child that the direction that you're going to go, what is coming up next, so the child can prepare him or herself. You want to check with the child to ensure that the child is understanding the information that you're providing, and he or she is able to start the activity that you're having him or her do at that point. And you keep the language that you are using with the child simple so the child can understand and process it. And also give that child extra processing time. A lot of times we are so quick, we are very, very quick to move on when a child doesn't respond. But be patient and give the child the extra processing time so that he or she is able to complete the activity. This is Dr. Yonnette saying to you this morning, thank you for joining me, and I hope that as you continue to work with your child, you will have the success that you will need to raise the next generation of successful children. Have a fantastic Sunday.